How is meningioma brain tumor treated? When it comes to treating a meningioma brain tumor, the approach varies based on several factors. These include the tumor size, location, growth rate, symptoms, and the overall health of the patient. The main treatment options are observation, surgery, and radiation therapy. Systemic therapies are generally considered for cases that are resistant or recurrent. For small, slow-growing meningiomas that do not cause any symptoms, doctors may recommend a wait-and-see approach. This means closely monitoring the tumor with regular brain imaging, such as magnetic resonance imaging, instead of immediate treatment. This strategy is suitable for tumors that do not exert pressure on surrounding brain structures and are not growing significantly. It helps avoid unnecessary interventions while ensuring timely treatment if the tumor changes. Surgery is often the primary treatment for symptomatic meningiomas or those that are growing. The goal of surgery is to remove as much of the tumor as possible without harming critical brain structures. If the tumor is in an accessible location, complete removal can lead to a cure in up to 85% of cases. However, if the tumor is near sensitive areas, only partial removal may be feasible. After surgery, the next steps depend on whether there is any visible tumor left and the tumor's grade. If no tumor is seen, follow-up imaging may be all that is needed. For small residual benign tumors, doctors might monitor them or consider focused radiation therapy. Higher grade or irregular tumors typically requiring additional radiation treatment. Radiation therapy is often used after surgery if the tumor is not completely removed or if it is of a higher grade. Stereotactic radiosurgery, a precise form of radiation, can effectively stop tumor growth in up to 80% of cases. This method is particularly useful for small residual tumors or those located in difficult-to-reach areas. Another technique, intensity-modulated radiation therapy, targets the tumor while minimizing damage to healthy tissue. Currently, systemic therapies such as chemotherapy, hormonal therapy, and targeted therapy have limited proven effectiveness for meningiomas and are generally considered experimental. These treatments may be used as a last resort when surgery and radiation are no longer viable options. Research is ongoing into targeted therapies based on the tumor's molecular profile, focusing on specific mutations. Some agents, like somatostatin analogs and anti-angiogenic agents, have shown promise in clinical trials but are not standard treatments. Hormonal therapies, such as progesterone antagonists, have not demonstrated significant clinical benefits. In summary, treating a meningioma is a personalized process that balances the characteristics of the tumor with the patient's individual factors. Surgery and radiation therapy are the cornerstones of treatment, while observation may be appropriate for certain cases. Emerging targeted therapies show promise but are not yet part of standard care. It is essential for patients to seek personalized medical advice from specialists experienced in brain tumors to determine the best treatment approach for their specific situation.